I pulled a Republican aside on the floor and I said, hey man, there's no cameras around here. I just want to understand. Like, I'm not here to put you on blast in front of a camera, just person to person. I genuinely want to understand, because people think that trying to understand another person means that you agree with them or that you're being soft on them. And it's a huge problem in this day and age, because that mentality really prevents people from being able to connect and persuade. But I pulled this guy aside and I said, hey man, like, I know that you represent a couple of rural hospitals, and this bill is going to devastate rural hospitals. I just want to know from your perspective, are you worried about that? What are you thinking about with your hospitals and your people? Because a lot of people don't know, like a ton of ACA recipients are in red states. A lot of Medicaid recipients are in red states. These are like Trump voters that are almost disproportionately, in many circumstances, being negatively affected. And so I said, like, walk me through how you see this. And he was like, yeah, I just don't believe it. He's like, I know that you guys need to make a big deal out of this to like score political points, but I just don't believe it. And I'm kind of sitting here like, this data shows that this bill is going to devastate a lot of people. But a lot of these folks just like don't believe that data. You know, there was one hospital in one of these districts. I was like, yeah, we might have to close. And they are now on their back foot. Like, they thought this was just a Democratic talking point. And now that their own people are being affected and their own hospitals are warning them, they are now kind of low-key panicking.